Hello everyone, I'm Lance Rooney, the designer and producer of this video course, How to Power Up Your Immune System to Build Resistance to Viruses, including COVID-19. Now in this course you'll learn about the components of the immune system itself and how it functions, typical unhealthy practices which weaken it, and more importantly of all, how you can strengthen your immune health to help protect yourself against COVID-19. But before I begin, I'd like to briefly take you through my health challenges and my journey towards wellness. My story started while I was living in Qatar in January 2013 when I was diagnosed with a nodular melanoma, the most dangerous of the 8 different types of skin cancer on the right side of my chest wall. Now the tumour was surgically removed 2 months later, but in December 2015 I discovered that the cancer had spread to 2 lymph nodes under my right arm, and they were also cleared 2 months later. Now those 2 surgeries were quite easy choices to make, but I faced a really difficult decision right afterwards when my oncologist strongly advised post-operative immunotherapy treatment. However, as my research revealed 41 side effects of the drug ipilimumab, some of which were really awful, and considering the fact that I faced the likelihood of death within just 5 years if I went down this purely physical and conventional path, I rejected it in favour of a holistic approach of alternative and natural therapies, together with mind power. Now, as you might know, there's much clinical evidence which shows the effectiveness of complementary and alternative medicine, or CAM, in the treatment of numerous health conditions, and that many CAM therapies are rooted in the sciences of epigenetics, how your beliefs control your biology, not your genes and inheritance, and psychoneuroimmunology, the interaction between psychological processes and the nervous and immune systems of the body. Over 4 years later, I continue to be healthy and cancer-free. But as my journey progressed, I felt a real need to share my experiences of helping prevent cancer recurrence with CAM therapies. And so I researched and wrote an ebook, 15 Things You Need to Know to Help Prevent and Heal Cancer Naturally. Now I followed that by designing and producing a 24-module video course, Your Mind Journey Towards Wellness, which focused on taking care of both the body and the mind to help achieve a real state of physical and mental well-being. Now, in these deeply troubling times of the COVID-19 pandemic, I'm turning my attention to the concrete steps that you can take to help keep your immune system strong and so help protect yourself against this virus. Now, of course, the first thing you can do is to follow the guidelines set out by your respective government. In the UK, as of April 20th, 2020, those guidelines state that people are only allowed outside of their homes to go to work if they can't work from home, to purchase food and medical supplies or to deliver such provisions to vulnerable relatives and friends, and to exercise once per day with members of their own household. Furthermore, when people are outside of their home, they must follow social distancing guidelines by ensuring a minimum 2-metre space between themselves and others, as this virus can be spread by coughing, sneezing, and even talking. People are also advised not to touch their face after making contact with any surfaces outside of their home, and to wash their hands for a minimum of 20 seconds or use a hand sanitizer as soon as they return. Now, the wearing of face masks isn't mandatory in the UK at the moment, as there isn't sufficient evidence that they prevent infection or transmission of the virus. Now let's take a very brief look at COVID-19 before we get to the immune system itself in this module. Firstly, we need to differentiate between the specific coronavirus itself, in this case SARS-CoV-2, SARS is the acronym for Severe Acute Respiratory Syndrome, and the disease that it causes, COVID-19. It's also important to know that one person testing positive for this coronavirus may have very different symptoms compared with another, while others may not display any symptoms at all, in which case they're called asymptomatic. Now, for instance, Scotland football legend Sir Kenny Dalglish was diagnosed with the virus on April the 8th, but was totally asymptomatic for COVID-19. However, Hollywood actors and husband and wife Tom Hanks and Rita Wilson had very different experiences with the disease after they announced via an Instagram post on March the 12th that they're both tested positive for COVID-19. Wilson described feeling achy, having chills and an exceptionally high fever, while Hanks had very mild symptoms. However, around 1 in 6 people diagnosed with COVID-19 become seriously ill and develop severe breathing difficulties that may lead to death. Now, as of April 20th, worldometers.info, a website that provides live updates on COVID-19 statistics, reports 2,421,018 cases of coronavirus around the world, with 165,890 deaths, which makes almost 6.9% of cases. Now, most cases are occurring in the US, which is almost 4 times higher than the second most hit country in the world, Spain, and almost 7 times higher than my country, the UK, which is number 6 on the list of worst hit countries globally. Now, anyone is at risk of contracting coronavirus, even the rich and famous, as I've already shown. But this also extends to a person's age and underlying level of health. Although even very young people are at risk of COVID-19 disease, older people are the most vulnerable. For instance, of the 6,839 deaths reported by New York City Health on April the 14th, 309 people in the 18 to 44 age range died, compared with a massive 1,683 in the 65 to 74 age group. Furthermore, people with pre-existing medical conditions like asthma, type 2 diabetes, immunodeficiency and heart disease are more vulnerable to becoming severely ill with the virus. For instance, of those 1,683 deaths in the 64 to 74-year-old age group, 76% also had an underlying health condition. However, we know that these diseases are all profoundly impacted by your diet and lifestyle, and that a healthy and optimally functioning immune system is a critical line of defense against viruses of all kinds, including SARS-CoV-2. So, let's take a look at the immune system, what it's comprised of, and what it needs to function as a powerhouse to help protect you against COVID-19 disease. Your immune system is your body's network of organs, tissues and cells that work together to keep you healthy by fighting off harmful bacteria, viruses, parasites and fungi. Your immune system comprises 2 main parts: mucous membranes found in your nose, eyes and mouth, which use white blood cells to fight infections before they can get inside you, and T cells and B cells, which work together to create antibodies that fight off invaders and then destroy infected cells throughout your body. Your bone marrow and spleen also play major roles in immune health by making white blood cells that fight infections. And then there's your lymphatic system, a network of tissues and organs that help rid the body of toxins, waste and other unwanted materials, and whose primary function is to transport lymph, a fluid containing infection-fighting white blood cells throughout the body. Now, while there hasn't been a lot of research on the foods and nutrients that are helpful with COVID-19 specifically, it stands to reason that the same foods that are incredibly important for overall immune function and that are helpful against a common cold, which is a coronavirus itself, cases of flu and other viruses are just as important now. While regular exercise, preferably outdoors in nature, plenty of sleep, and good strategies to minimize the effects of stress on the body are all important in a healthy immune function, it's almost impossible to exaggerate how important nutrition is in promoting a robust immune system. You need a diverse group of phytochemicals, the bioactive chemical compounds in plants, to create a strong barrier against pathogens that would otherwise make you sick. Now, because immunity typically declines as you age, and as we've seen how more elderly people are at greatest risk of developing the severest symptoms of COVID-19, it becomes especially important to eat more immune-supporting foods as you get older. Now, although many studies have shown that nutrient deficiencies cause impaired immune function in the elderly, even people in their mid-30s can experience a severely compromised immune response as a result of poor nutrition. So, in this course, I'll be looking at specific steps that you can take starting right now, which will ensure a powerful immune system that helps make quick work of viruses like SARS-CoV-2 and the resulting COVID-19 disease. You'll find modules on the biggest threats to your immune system, how you can detoxify your body, and the value of a plant-based diet, vitamin D, vitamin C, garlic and zinc in developing a powerful immune system, as well as how the power of the mind and empowering belief systems add to that armour. In Module 2, we're going to begin with a look at 5 key threats to your immune system and what you can do to overcome them. I look forward to seeing you there.